This is the Emergency Medical Minute, sponsored by Health One.
Hey, super friends. So I have a very quick medical minute to give everyone about buprenorphine again. So buprenorphine, we all know and love in the emergency department because it allows us to actually treat opioid use disorders. And when we treat patients with opioid use disorders with buprenorphine, we know that we decrease their morbidity, we decrease their mortality, we decrease, all the bad stuff we care about. And patients get their life back and are no longer in kind of this constant state of intoxication and withdrawal from heroin and other drugs. So buprenorphine, one of the things that we've always been taught is that you have to only give buprenorphine to people who are in full opioid withdrawal and who haven't used opioids for multiple hours. And there's a letter to the editor of the Annals of Emergency Medicine that actually challenges that in the face of one of our most common presentations for opioid overdose. So the clinical situation here is that a patient overdoses on heroin or on prescription pills. They get naloxone by EMS or by a Good Samaritan, and then afterwards they're brought into the emergency department. And we've all seen these patients. These patients feel horrible. They're in opioid withdrawal. They're covered in goosebumps. They're vomiting. They're tachycardic. They're dysphoric. And the argument made is that is the perfect time to give these patients buprenorphine. Because if you don't give them buprenorphine after they've overdosed on an opioid, we know that their mortality rate within a year is 10%. Their mortality rate within a month is 5%. And the most dangerous time for that patient is actually the first 48 hours after they've overdosed. So all that is known. And the argument here makes sense both from an intellectual standpoint and then also a physiologic standpoint. Is every time you have a patient with opioid use disorder in front of you, you should be trying to get them onto treatment for their underlying disease, that opioid use disorder. With buprenorphine, we know that that's safe, that's effective. All you need is a mouth and a tongue to put that buprenorphine under, and you can start patients on that road to recovery. When we've looked at it before, we've kind of argued that buprenorphine should only be given when you're in bad withdrawal. And most people think you have to be abstinent from opioids for a significant amount of time to do that. What kind of Andrew argues, and Andrew Herring is the author of this op-ed, is that after patients receive naloxone, it's actually the perfect time to start them on buprenorphine because patients are already in pretty much maximal opioid withdrawal. So giving them buprenorphine, which is an extremely strong agonist, actually knocks a lot of that naloxone off the receptor, improves patients' opioid withdrawal, and then protects them because, of course, you've then started them on treatment for their opioid use disorder. And if they even were to go out and use heroin or something else, that they still have that buprenorphine in their system that would kind of blunt the possibility that they overdose. So let's bring it into a take-home. 1, we love naloxone, saves a lot of lives. 2, when patients come in after overdosing on opioids and receive naloxone, you should give them buprenorphine. 3, it's safe, and I'm looking forward to integrating this into my practice. And finally, thanks to Andrew and his team out in California. They're continuing to pioneer a lot of work around buprenorphine for emergency departments across the country. And they have an awesome website. If you haven't seen it, it's called Bridge to Treatment. It's bridgetotreatment.org. Or you can see the Colorado-specific one that we've created for Colorado emergency departments, which is coloradomat.org. Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.